Choosing the appropriate time to start your family can be extremely difficult. Increasingly, women are faced with this complex problem, with education, career, financial stability, and being with the right partner all entering into the equation. The result has been an increasing age at which women are considering childbearing.
Recent information shows that for the first time in almost 100 years, there are more women in their 40s having children than there are teenagers having children. A huge change in the way we order our society and have our families. There are many reasons for having your children later. You're more settled in your relationship perhaps, and you're more mature. You probably have a bit better of an income and maybe afford to take time off work to be with the child that you might not have done in your earlier years. Medically, there are some challenges for women who are older compared with women who are younger. Firstly, pregnancy doesn't happen so readily as it did. And when pregnancy happens, miscarriage is a bit commoner. And the baby that's born has a higher chance of having a chromosome abnormality. But these things need to be put into perspective. Firstly, most people do manage to become pregnant naturally. Secondly, only about 1 pregnancy in 5 would miscarry in a woman who was older. And thirdly, although the incidence of fetal abnormality and Down syndrome is higher, about 99% of babies born don't have Down syndrome. So there are real positives looking at the glass being more than half full rather than the glass being less than half full. There are a number of reasons why women don't conceive quite as quickly as they might have when they were younger. Firstly, they may not be having sex as often as they did when they were younger in their relationship. The egg that they're ovulating isn't as fertile and often contains lethal abnormalities which stop pregnancy happening. And the egg might not have the same amount of energy in it which it needs to continue to grow into an embryo. I think that there's an awareness in the community that eggs age as the woman ages. However, most people don't think it applies to them. They're aware of the statistics of the general population, but know that because they've kept themselves fit and eat a healthy diet and don't binge drink and don't drink too much coffee, see the naturopath and have acupuncture, that they'll be fine. Unfortunately, the ovaries don't know anything about that, and they just march to their own drumbeat. And often, despite the woman having done everything which she thinks that she ought to have done to keep herself healthy, the ovaries will sadly be running out of eggs, and these eggs will perform relatively poorly when given the chance to fertilize and turn into embryos. If you're in your late 30s or early 40s and haven't yet come to the decision with your partner or as an individual to have a child, then time is not your friend. Your fertility, statistically, is much less than it was in your late 20s or early 30s. And it really is time, if having a child is such an important thing to you and your life plan, it really is time to seek medical advice.